Good afternoon. Thanks, everybody, for joining. We have a number of things to cover today. Commissioner McCord with Labor and Workforce is going to be here to talk about jobs in the month and workforce development. Commissioner Schwinn is here to answer questions about school reopening. Dr. Piercy will give a health update and talk about where we are in COVID and the challenges we're facing right now. But before we get started, I want to acknowledge the loss of Staff Sergeant Ryan Knaus in Afghanistan last week. It was a tremendous loss for our state, certainly, and I spoke with his family, and it was heartbreaking and very difficult, but we share in their grief, and we certainly have deep gratitude across the state for Ryan and the sacrifice that he made. And the 50 almost 50 Tennesseans that have sacrificed their lives in Afghanistan. We are grateful, and their service and their sacrifice is not in vain. And we reach out to and appreciate and pray for the especially the Knaus family right now. I certainly hope that we offer friendship and support to all of our veterans in the months ahead. It's been a hard month for many of them as they consider their fellow veterans and the losses that they face and the struggles that they've had. If you're an employer, by the way, we are talking a lot about labor and workforce development this month. If you're an employer, we encourage you to pursue a strategy for hiring veterans. There's tremendous opportunity, and we want to make sure that we engage with our veterans in that. That's a little bit of what we're going to talk about today with Commissioner McCord. There are nearly 24 job fairs that we'll be having across the state here in the month of September, which is Workforce Month. Dozens of other opportunities for people who are looking for employment in Tennessee. We're going to be talking a lot about vocational education, about apprenticeships, about the pipeline of education into the workforce. We're really going to be talking about opportunity for Tennesseans. We have almost 500,000 job openings in our state right now. In 2021, we've recruited about 22,000 jobs into Tennessee, so there is a tremendous amount of opportunity, and we want to connect those who are looking for employment with the opportunities that are there, and we're working very hard to make that connection. There are companies coming from all across the world, frankly, and certainly from across the country to put operations in our state. That means opportunity for more Tennesseans, and we want to make sure that Tennesseans know how to connect with that opportunity. I hope that if you're looking for employment in this state, that you will engage with the opportunities that we're providing this month to help you find that employment that works just right for you. Commissioner McCoy, do you want to come up and talk a little bit about the specific things we're doing this month that people can engage in?
Absolutely. Thank you, Governor. This month is National Workforce Development Month. And as part of that, Tennessee will be celebrating Tennessee Working Week, which will be the 13th through the 17th. And we will highlight those half a dozen or dozen career fairs, but there'll be as many as 75, 100 this whole month in September to connect people to opportunities in the workforce. Workforce development is always a high priority for the state of Tennessee, but with the Bureau of Labor Statistics continuing to report record level, historic level job openings, it's even more the forefront than it ever has been. And we work on this every day from things we hear about job fairs and our investment in technical education, but for example, Tennessee has now more apprentices than we've had in over a decade. After we established the Office of Apprenticeship, we had about 100 and 150 of those every month. Our adult ed population, the folks pursuing a high school diploma, now have the opportunity to dual enroll and take technical courses as well as work-based learning. Our reentry population, our justice involved population, have multiple opportunities to get involved with both education, job training, and actually jobs connectivity. And as the governor mentioned, our veteran population, we have 400 people, service members transitioning just from Fort Campbell every single month. And the connection to those folks with jobs and job training for needed skills and for employment, for their own personal prosperity, but also for workforce development. And finally, we have efforts, and Commissioner Swin can speak to this better than I can, work-based learning in the high schools. So we introduce students to work at an early age. It's going to be a good month. We're going to highlight it this month, and particularly the week of the 13th through the 17th. But again, something that we do all week, not all week, but something we do every day of the year to promote workforce development and the prosperity in our state. So thank you, Governor.
Thank you, Commissioner. And we hope that every Tennessean will engage in the opportunity that's available out there. Dr. Piercy, if you would come up, give a health report. We're in a very difficult spot in this pandemic right now. We all know that. It's particularly challenging with regard to hospitalizations. She's going to give a report about those hospitalizations, case counts, particularly pediatric cases. I'm very encouraged by the fact that we do have and have had 150,000 or so Tennesseans get a vaccine in the last week. This is the best tool we have to fight the pandemic, and we encourage Tennesseans to get a vaccine. But Dr. Piercy, why don't you give your report?
Thank you, sir. I will start with an update on hospital capacity. Yesterday, we hit 3,500 hospitalizations statewide, which exceeds our wintertime peak of 3,300. Our ICU cases are now 20% higher than the winter peak, and our ventilator use is 40% higher than our wintertime peak. Our hospitals are in dire straits. Fortunately, our hospitals in Memphis and West Tennessee are starting to see a little bit of leveling off. They are still critically full, but they are starting to see it slow down just a little bit. That makes sense because it started in the Memphis and West Tennessee area, mostly because of their proximity to Arkansas, Mississippi, and Missouri. But what we're now seeing is that the hospitals in Middle and East Tennessee are starting to feel that strain that West and Memphis hospitals felt a few weeks ago. We now have National Guard deployed to 16 hospitals statewide, and a few days ago we released $10 million in funding to assist hospitals with staffing. I want to remind you what you can do to help hospitals. Sometimes it's easy to think that's a hospital problem, that's a state problem, that's somebody else's problem. It's actually everybody's problem. And what you can do is, if you haven't been vaccinated yet, get vaccinated now. We still have close to 90% of all COVID patients in the hospital are unvaccinated. Something else that you can do to help hospitals is don't go to the emergency room unless you have a true emergency. A lot of people are in the habit of going to the ER when they need a quick test or they need just some reassurance. Please use another setting for that kind of testing, whether it's an urgent care clinic or your doctor or health department. We're starting to see some standalone testing sites being popped up. Please use one of those. And you know what I'm going to say next? Don't forget about monoclonal antibody. It should be your first call after you get that positive diagnosis. It has significant reductions in progression to severe disease, but you have to get it early. The good news is that it's starting now to be also given in outpatient settings. So in addition to the 70+ sites we have on our website, most of whom are hospitals, you now have availability in some doctor's offices and other standalone sites, so be on the lookout for those. And one other thing that we haven't talked about before as it pertains to monoclonal antibodies, kids down to age 12 can get monoclonal antibody as well, particularly those high-risk kids. And they're the same high-risk categories that we see in adults. So diabetes, severe asthma, obesity, and in children, Down syndrome, genetic conditions, or heart disease, congenital heart disease. I had the opportunity to be on site at East Tennessee Children's Hospital in Knoxville this morning. They've given over 100 monoclonal antibody treatments to children, and to date have only resulted in one hospitalization of those kids. Speaking of case trends overall, our case numbers do continue to rise. We are currently averaging about 7,700 new cases per day. I do want to alert you that today's numbers are going to be artificially low. We had an aberration in our data pool, so you're going to see probably in the 3,000 plus range today. That will be caught up tomorrow. So I wish that were good news today, but it's actually just a little bit of interruption we had in our data pool, so I wanted to alert you to that. Like last week, over a third of the cases, right now 38.5% of the cases in the last week were amongst children. I'll leave you with some good news. Vaccine uptake continues to increase. Across the state, we're seeing increased vaccine uptake across all age groups, with the biggest increases in the 12 to 15-year-olds and the 16 to 20-year-olds. I want to give particular shout outs to Van Buren County and Hancock County. In the last 7 days, the vaccination rate has increased by 70% in Van Buren County and 50% in Hancock County. Keep it up. I really want to challenge the other counties, particularly the rural counties. I want you to go after those numbers too. people all across the state are starting to take vaccine that have been hesitant. It's time to do it now. And let me give you one other reason to get vaccinated now. You start to get some protection within the first 10 days after getting that vaccine. You're not fully protected yet, but don't think we're in the middle of a surge and it's too late for me to do it. It's not too late. Get your vaccine today. Thanks.
Why don't you stay up here, Dr. Piercy, just in case Commissioner Schwinn, will you come up too, just in case we have questions around school opening? And Commissioner McCord, if we have questions, I'd like you to be available too as well. So thank you all for joining us. A lot of topics, and we're grateful for your providing information to the public. So let's get started with questions.
Actually, I have a question for Commissioner Schwinn. I have a question about the video that was on the Tennessee Department of Education, that's on Facebook and Twitter page yesterday. Do you feel like that was the right message? You're talking about the smell of fresh books, clean hallways, but meanwhile we have school districts temporarily closing, parents terrified to send their kids to schools where they don't know if other students will be wearing masks. Was that the right message in that video you made?
Yeah, so I think it's an important point about where we are in terms of school reopening and frankly the critical nature of adult leadership. And so we've talked a lot about things like mental health during this pandemic. Our children are in their first days of schools. And when we look at people across the country, whether they're other state chiefs or district leaders, it's really important for us to both hold and acknowledge that this has been really, really hard. And every day when I'm talking to folks, I acknowledge it's really hard. I'm experiencing the same things in my own family. And just like across the state, my little girls went to school. And as their mom, just like as teachers do every single day, we have a responsibility to take that energy and say, we want this to be a good day for you. And so yes, it has been really hard. The pandemic has been very challenging, and we've been talking about it for a year and a half, and it's still the first day of school. And we have got to find a way to balance and say it's okay to hold both the joy of a new school year for the 1 million kids who are going to school every day and hold with us the challenges of a pandemic. The only other thing I want to say is our Teacher of the Year from last year did a speech at our banquet. We had a big banquet for Teachers of the Year, and her entire speech was about how important it was for our educators and our leaders to hold the positivity, especially when it's hard. And I think teachers do that every day, and I want to be able to follow their lead, also understanding how challenging it's been this year.
Gerald.
Governor, Tennessee is leading the nation in COVID-19, #1 per capita. Are you being more negligent in penetrating local school districts' ability to keep kids safe by wearing a mask, and most importantly, keep kids alive?
Yeah, we're in a very difficult position in our state with regard to this moment in time for the pandemic. As you know, it's particularly with this variant, it's moved from state to state, multiple states leading the charge. Now we're in the spot that has the highest case per capita. That makes us all very concerned, and we're particularly interested in the health and well-being of our children. And districts do have the ability to impose a mask requirement in any school district across the state. And as I've said to parents, for those who have children that are 12 and over, you have the ability for your kid to get vaccinated. You ought to consider that. Every parent has the ability to send their kid to school with a mask. They ought to consider that, and I hope they'll do it.
Governor, are you changing your tune on that? Are you saying that local school districts can't require a mask, and that your executive order will not allow students to opt out of mask mandates?
The law allows, and we allow, school districts to impose a mask requirement in their district. But the law also allows for a parent to have the ability to opt out of that mask requirement, and that still exists. We have multiple districts that have imposed mask requirements, and parents have the option to opt out of that. But we actually are seeing high levels of adherence and a lot of kids wearing masks in those districts. You know, part of the challenge here and part of what we hope is we all have the same common goal, and that's to protect the health and well-being of our children. Everyone wants that. We want to develop strategies that develop the greatest adherence for protective measures. And we think we've done that with the strategy so far.
Governor, you mentioned Afghanistan a couple of times, and the last time we were asked, you didn't really answer this. Will you accept, yes or no, Afghan allies and people who help troops in Afghanistan?
Allies of ours that were Afghans, absolutely. We should stand with them as they have stood with our men and women of the military. Stella.
Hi, so, yeah, like Charles mentioned, Tennessee is seeing its metrics continuously worsening, especially among children. Just now, Commissioner Pierce said about more than 38% cases are among children. But you have allowed for the opt-out order. So does the state plan to do more than that, more restrictive measures to curb the spread of the virus anytime soon?
We do think that the strategy we're taking is the one that is the way forward, that best navigates the circumstances we're in, and that allows for adherence across the state, gives parents the ultimate decision-making process with regard to their health, the health and well-being of their own children, but advocates for them to use the tools necessary to protect kids. So we don't have any plan to change that going forward. We are working really hard to protect the lives and livelihood of those kids. Phil?
Sorry, a follow-up question. So, over the past, a few press briefings, you have encouraged, vaccination. Commissioner Pierce has encouraged vaccination. You have encouraged parents to protect their kids, but we continuously see the metrics, the numbers going up. So, what more needs to happen for the state to take a different approach, to take further mitigation measures, to do something more?
Yeah, more people will need to get vaccinated. More funding needs to go to hospitals to provide for staffing assistance, which we released last week. More flexibility needs to be provided for hospitals, which we've done in previous executive orders, and we'll consider that moving forward, opportunities to do that. There are a number of efforts that our folks are taking every single day to try to navigate our way through this crisis, and we will do so. Phil.
Governor, you said that school districts can impose mask requirements. Yet you also say that parents cannot opt out. If it's a mandate, parents should not be able to opt out. Or why should Tennesseans not view that as political double speak where you're trying to have it both ways?
Yeah, I think what we're trying to do is to provide for as much protection as possible and provide for the rights of parents to have the last say in their children's health. We think there's a way. We think you don't have to exclude. You don't have to have either or. We really believe that you can find a way forward that allows for the best adherence possible, and that's what the strategy is.
So why not just say that schools cannot impose a mandate, because that's essentially what your policy is. It's a recommendation.
Yeah, so we think that if schools impose a mask requirement, then there are a number of parents that then will be alerted to the circumstances in their area, and that it might, in fact, increase adherence to that policy. We believe that masks work, and that if you want to protect your kid against the COVID virus, one tool that you would have is to send your kid to school with a mask. That's why we encourage people to do that. And that's why we continue to give districts the opportunity to impose those requirements.
You received a letter recently from the head of St. Jude's Children's Hospital. You met yesterday with representatives of the Tennessee chapter of the American Academy of Pediatrics. Those health officials say it's not enough just to send your child to school with a mask, that universal masking is required. Why are you not heeding the advice of those medical professionals?
Well, first of all, I very much appreciate their outreach, and I have had dialogue with the head of St. Jude and other health officials across the state, and do that on a regular basis, and had conversation with the pediatric group just yesterday. I value their input. We had a very productive conversation about how it is that we share out the desire for outcomes and how complicated this is going forward. So I value their input. We use it in our decision-making and will going forward.
But you're not following their advice to move those.
We agree that we don't agree on every issue, but that there are many things we agree on, and we're going to try to work together. Yes.
There have been multiple school districts now asking you to put in order to allow them to do continuous learning plans. Are you willing to listen to them and give them more flexibility in their systems?
I think we've worked really hard to give flexibility to schools with regard to quarantine cases, and we worked really hard last week to develop that strategy going forward with the goal of keeping school districts open and to not returning to district-wide virtual learning across our state. We think it's very important to be in person. We think most districts believe that, and frankly, they're all working very hard
A lot of districts are now using stockpile days instead of going remote. Do you think a stockpile day is better than remote learning?
I think that the way forward is difficult for districts, and we're trying to give them unique flexibility to operate that way. Penny, do you want to add to that?
Yeah, so I think a couple of things. The waiver process obviously just started about a week ago, and so districts who are choosing to use stockpile days, that is a local choice. They still have the option of submitting for a waiver to the department at the classroom or at the school level, and they can choose to use a stockpile day at the school level or apply for a waiver. We've received 15 waivers. 3 of those were not necessary, actually, because existing policy would allow for them to quarantine the school or the classroom at that individual student level at scale. The other 12 that we've received, we've approved 10 of them. Now, there's a lot to talk about too, but 10 of the 12 have been approved. I was on the phone with superintendents yesterday, middle of the night actually, yesterday, as well as throughout today, and they are actually asking more for strategies about how to stay open and flexibility should they need them. And so certainly that conversation is ongoing, but there are lots of options that they are utilizing right now, and the waiver process is one of those.
So it's a local choice for those individual schools, but not for district-wide remote learning.
That's right. I think it's important we take a scalpel and not a sledgehammer approach. Someone really smart said that to me a few weeks ago. And so we want to make sure that this year, especially looking at students and the critical need of them to be in classrooms, to make sure that they are moving forward academically, that they are getting the supports that they so desperately need in many cases, that we're keeping schools open. And so instead of having a district-wide approach, saying we've made a commitment to families in the state to offer in-person learning throughout this year, and as a result, we want to give districts that flexibility at the school and the classroom level if they need it, but not in these broad brushstrokes.
Do you have any thoughts on the U.S. Department of Education's civil rights investigation?
I mean, we just got that letter. We're reviewing it, and we'll develop an appropriate response to that in time. But we've just gotten it. We're just reviewing it.
Earlier this year, we heard repeatedly that local authorities should be followed in terms of things like mask mandates. Do you think that your administration has shifted in terms of the rule on virtual learning and maybe virtual districts?
Well, I think we're working with districts right now to accomplish overall goals and to work with them at the same time. It's a little bit like the issue with masks in districts. We can find a way forward in some of these really difficult, challenging situations where we have 147 districts and yet there are some goals that we want to have as a state, statewide, and that's the goal here.
I also have a question for Commissioner Ford. Sorry. Have you seen any impact, or what, if any, impact have you seen on unemployment in Tennessee as the federal extended unemployment benefits?
It's still really early. We're just weeks from those benefits ending. Of course, that ends across the country this week. We are seeing employment continue to increase. Looking at numbers yesterday from our low in April 2020, we're 450,000 more people employed, and we continue to re-employ people across the state. And once again, our unemployment rate continues to go down. All of those are very, very positive signs.
Mr. Governor, you have Shelby County has filed a lawsuit against you, and there's been a class action lawsuit filed by families in Shelby County as well. And now you have districts, red districts, such as Wilson County schools, Sumner County schools, shutting down to deal with COVID. I mean, did you bear some responsibility for all of this situation?
Yeah, my responsibility is to work together to make the best decisions in our state that we believe will benefit Tennesseans as we navigate through what is a very difficult situation, to work with school districts, to work with parents, to work with people across the state. That's what we're doing.
But you don't feel like your policy has led to this situation, especially with Sumner County and Wilson shutting down?
I think a pandemic has created a large number of infections across our state, a pandemic that swept through the globe. And I think we see that in school districts. We see that in cases of pediatrics across our state. We see that in schools having to make difficult decisions about how to keep classrooms open and closed. This pandemic has wreaked havoc on the world, and it's doing the same thing in our state, and we're doing everything we can to battle that. Yes?
This question is both for you and Commissioner Schwinn. You both said that you've given school districts options to pivot schools to remote learning, with options to kind of mitigate what's going on when teachers and kids are out. I spoke with a school leader yesterday whose waiver was denied, and this is a small district, 7 schools. They didn't have enough staff, so they closed regardless. So in your opinion, is it better to just close completely for 2 days versus remote learning? Or what's happening with that lack of instruction for those 2 days?
Yeah, I think these are very difficult decisions that we're trying to help districts make as they go forward. You want to address a specific waiver?
Yep, so we have approved 10 waivers. As I said, we've denied 2. Of the waivers that were denied, one of those waivers, it was 50% of their students were in quarantine or isolated, but 100% of the teachers, per what was submitted by the district, I can't know anything besides what they submit, 100% of staff was available in the building. In that case, I've got 50% of students whose parents are going to go to work and they can be in person for learning, and all of the teachers are in place. So that was denied for that reason, because 50% of kids deserve to be in person if they can be. In another case, we had a scenario where there were 3 different school situations. In all of those, it was less than 10% of the students who were absent or who were going to be absent, and in all of those cases, it was 10% or less of the teachers. And so that was one, again, where you could see a number of things. Right before holiday weekend, we see similar trends, and when we thought about what was important for those 90 to 98% of kids who needed to be in person that day, we made the call of saying, yep, that isn't one that seems to warrant a full school closure. If the district makes the decision to close anyway, again, that is something that would be decided at the local level. The other thing that I want to emphasize is that districts should continue, we talk about this every Wednesday on our superintendent call, should continue to maximize the mitigation strategies they have in front of them. I think seating charts and cohorting of students is another thing that we need to see more of. It limits the amount of different contacts within a school day, especially for our little babies who tend to run around and do all sorts of things on the carpet. And so we want to make sure that we are mitigating as much as possible. But those two were not approved. The other 10 were.
Just to follow up,
Sure.
I mean, if a district has said, look, we don't think we can operate, this is our local decision, and the state says, no, we think we can, but they close anyways, and this is not a Shelby, this is not a Davidson, this
Yep.
is a small rural county, does that not tell you that maybe the state is not providing enough support to that district?
Yeah, and what we've talked about with districts, and I actually think there's a really good example in East Tennessee, another small, relatively rural district. Their original application, the information they provided, did not provide enough information for us to approve it. We actually got in contact with the superintendent directly. The superintendent said, look, I didn't think to say all of these other things. And I said, that is wonderful. Can you just actually make sure that we know that, because we don't know what we don't know. And then the application was approved. And so part of that is just making sure that if you are telling the state, this is where we are, that we're able to respond appropriately. The other example I would give is bus drivers. We know that there's a shortage of bus drivers across the state. There was before COVID, there will continue to be. And that might mean that you have 99% of your staff in the building, but if you cannot actually physically get kids to school, that is a reasonable thing to ask for an accommodation for. And so again, we can only know what's in front of us and not make assumptions. And so I encourage superintendents to ask for a waiver whenever they feel like they need one, in lieu of shutting down schools altogether. But just make sure we know what it is that's in front of us.
So just to be clear, do you believe that the state is supporting this to the best of your ability currently?
I believe that the waiver process provides yet another option for districts in terms of flexibility at that very small grain size for students, and that it is not a district-wide solution, so I would not characterize it as that.
Marta?
Yes. So you're encouraging people to wear masks or send their kids to school with masks. Science is clear that universal masking works best. And then you also talk about parental choice. Of course, all the parents who send their kids to school with masks, they believe that their kids are at risk because other parents are choosing a path that you allow them to choose. So, what about their freedom to have their kids protected and safe? There's a tension there.
Yeah, there's a tremendous tension, and that's the reason that we've, there are a lot of states that banned school mask requirements. We chose not to do that. We want parents to have the ability to have their kids go to school with a mask if they want. We want parents who believe that it's in the best interest of their children not to have that right as well. There is tension, and this is difficult, and there's a lot of disagreement, and there's a lot of angst in this country around a lot of issues that are very hard for people right now, and we're doing what we believe is the best way forward.
What would you say to a parent of a student with disabilities who is severe risk, and because others are choosing not to use that
Yeah.
counseling?
I would say, yeah, it's very difficult, very challenging situation we're in. We actually also have a group of parents I think we've seen across the country with autistic children who they believe cannot keep a mask on and are being discriminated against with mask mandates, and children who are deaf and can't learn to read without understanding, seeing what lip movement looks like. This is very difficult stuff. There are very great challenges around how it is that we keep kids in school safely. And we are working really hard to make sure that we hear from parents, that we provide. At the end of the day, I will say, I still believe that a parent is the best decider of what is appropriate for their child. There's no one that cares about a child more than their parent. There's no one who is more qualified to make decisions about the health and well-being of a child than that child's parent. And that's been driving our strategy thus far. Kimberly.
Switching topics just briefly, the Supreme Court has declined to weigh in and stop the Texas abortion ban, mostly an entirely abortion ban. I would like to get your thoughts on that, and if you have a plan to introduce a similar, if not the exact same law that Texas introduced earlier this year.
So I haven't read the Texas law. So I can't really speak to the particular nuances of that piece of legislation. I can only speak to what we're doing here. And I continue to believe and will continue to work to protect, especially as our law does, against discrimination for the unborn, to make certain that no child is chosen to be aborted because they have Down syndrome or because of their sex or because of their race. And that and the value of the life itself is something that we will continue to defend and protect. We do not have any current plans to move forward beyond what we are currently awaiting, which is a ruling from the court on the existing piece of legislation that we have.
Are you hopeful that last night's decision will mean that Tennessee's current legal battle or the other similar laws that are fighting for this will mean good things?
I'm just hopeful that the things that we do in Tennessee will protect the lives of the unborn. That's what I hope, is that the unborn are protected in any way that we can see that protection for them in this state.
Governor, we have time for a few more questions. I just
Right.
want to make sure everybody's mindful of
Yep.
time.
So if the Supreme Court does not change their thoughts on Tennessee's law, will you then want to adopt what Texas has?
Well, there's a Well, that's hypothetical. I have no idea what's going to happen in the future. I'm only following what's happening right now. The only one I know about and know the details of is our law. That is currently before federal court, and so much is left to be known about that. We'll wait and see what happens there.
Governor, there's been a lot of talk about the opt-out, but also the truth is that Nashville, Davidson County Public Schools, parents who have tried to opt out have been locked out of school. And I sat with a group of them the other day, and they're kind of wondering, they took advantage of your opt-out clause, and they feel like they'd be persecuted or locked out of school, and wondering if you are going to support them in any way.
Well,
this order being filed.
I would, what I believe is that districts should follow the law, and the law in this state is that there should be an opt-out, and parents should pursue that with their local school district and their local school board.
And I wonder if you've developed a position on Purvis Pena. I know you've seen the full Innocence Project like I have. We've talked about this in the past. But the two prongs in this, one is the lack of evidence, the missing evidence, and the fact that this man has an intellectual disability. It seems almost shocking to a lot of people nationwide that he is even on that.
Yeah, we passed a piece of legislation last year that allows for the evaluation of that mental capacity with regard to death row. That would apply to his case. So it's unfinished in his case at this point, but we're watching that and we'll continue to watch it. Is that it?
Governor, just to follow up on the opt-out in Davidson and Shelby, is there going to be any consequences as far as you're concerned from the two counties who don't adhere to your executive order?
Well, we certainly hope that they will adhere to the executive order. We haven't explored next steps for that. We have no. I was asked earlier if we're going to file a lawsuit against those districts. That's not, the state doesn't do that. If a parent has a problem with a district, then that is for the parent to take up with that school district, not for the state to. But we don't have any plans to pursue that further as a state. But we do believe that what we'll see is that challenged.
Well, you might not pursue litigation, but you could pursue legislation. Presumably, you could seek retribution against those districts.
Well, that'll be up to the legislature when they're in session and they make decisions about a number of things. They will look at a number of alternatives, and that'll be up to the legislature.
All right, Governor, that's all the time we have.
Thank you all.
Governor, you mentioned the fallen soldiers, but you mentioned the fallen teachers. Do you have any plans to mention any of the teachers that have already died?